Are your breasts sagging? Do you want some lift? Do you want some size? Well, at Rejuvenation MD, we can help because we do PRP, platelet-rich plasma, to provide a breast lift. And bonus, it could actually increase the size of your breasts as well. So I'm going to show you how the procedure works. We've already drawn the blood from our patient. We have spun it down twice, and now I have very concentrated platelets in my syringe. We've also numbed her chest area, so that way it's not very painful. It could be a little uncomfortable because we are going to be doing injections, but pretty easy once we take off that numbing cream. So I'll show you. We're going to go down and take a peek so you can see she's got numbing cream on, and I'm going to just wipe this numbing cream off. We usually leave it on for about an hour or so, and I'll show you how this goes. Very easy procedure to do. All right, how you doing? Are you okay? Great, okay. So we have been doing this for quite a while now, so I really enjoy the PRP breast lift. Okay, I just had wiped their numbing cream off and also used an antiseptic to clean her skin. So I'm going to start by doing a little injection spot right here. Are you ready? 1, 2, 3. Here we go. La la la. And we're going to just inject the platelets right in here. Are you okay? They can be a little spicy. And we use a little bit of bicarb to help with that bite, but they can help, like I said, with size, with lift, nipple sensitivity. It's great. They're great for. So the way it works is your platelets will signal to your stem cells to migrate to where they are. And your stem cells don't know what they're going to be. So when they come to the area where they are called to, they become whatever tissue type it is. So when you come to the breast, they become new adipose tissue, which is great, which is mostly what our breasts are made out of. Okay, next one right here, okay? 1, 2, 3, la la la. And it can take anywhere from 2 to 4 months, sometimes even as long as 8 months to see the full results from the breast lift. People often combine the breast lift with fillers. So if you want immediate result, we can do some filler right before and then add the PRP right after, like we do with the PRP facelift. We add filler first, and then we add the PRP right after. So the fillers give you an immediate result, and then the PRP gives you results over the next 3 months. I mean, over the next few months. Sorry, I misspoke there. Okay, so we're gonna go to the other breast. This is still PRP right here, platelet-rich plasma. Ready? 1, 2, 3. All right, you're doing great. And we're just gonna inject some right in the cleavage because we like cleavage. And it's a pretty easy aftercare. I mean, basically I tell people just to double bra when you're exercising. I recommend people do a treatment. You know, maybe you might need a couple treatments. It's hard, you know, it depends on what your goals are. You might need to do 2 treatments in a year or 3 treatments in a year, and then 1 treatment about every 18 months or so. Are you okay? Now they're spicy, aren't they? Okay. But the thing is, we tend to like what we see, and so people lots of times will be like, oh, I don't want to wait 18 months. I want to do it again now. Okay, we can. Here we go again. Oh, la la la. Sorry. Okay. Here we go. So you can see her breast getting fuller, but in about 3 to 4 days, that fullness is going to go away, and then they're going to start doing their thing. They're going to start working to get the stem cells over, and the stem cells become brand new breast tissue, adipose tissue. It's great. So now, after we're done with this, okay, I'm done with those 2 spots. You okay? Now that I've stopped poking you, probably better. Okay, so now we're going to use the platelet pour plasma, and I'm going to keep going across here. I'm going to go right over here next, okay? Are you all right? 1, 2, 3, hallelujah, Happy New Year, here we go. So this is platelet-poor plasma. So although platelet-rich plasma is where most of the platelets are, there's still good stuff in platelet-poor plasma. So let's inject it. And that is what we're doing. Turn your head to the left for me. Yep, good job. And wherever there's volume loss, we can put the platelet-poor plasma. Well, you can put it anywhere. I like to go around the breast. Okay, good job, good job. And then we're gonna hold on this one. But I think everybody gets the idea. I'm gonna keep going around her breast on that side, but I'll do one more over on the other side. And then again, post-care really is easy. Again, I recommend double brawling with exercise because it can be sore, because I'm poking you a few times. 1, 2, 3, and you're full of your own blood. So the nice thing is there's really no, yeah, these tend to be a little spicier, aren't they? There's really no risks associated with this. It is your own blood. Some people do bruise, but I don't see any bruising happening now. She's doing great. And like I said, you can do other things with platelets besides put them in your breast. You can put them on your face, and we can microneedle them in with the PRP facial, or we can do filler, and we can do the PRP face lift and put PRP in the cheeks or in the lips or in the nasolabial folds. We can also do something called the O shot that helps with female sexual wellness, the P shot that helps with male sexual wellness, as well as with incontinence. So that is basically the PRP breast lift. I'm going to do a few more injections, but I think you get the idea. And really you can see, I mean, nobody's going to know she did anything. You can barely see the marks. So if you have any questions, please feel free to email us. If you enjoyed this video, please share it. And of course, like and follow us on social media. That's always appreciated. And most importantly, come and see us at Rejuvenation MD.